Hello, welcome to this GCSE revision video on people's health 1250 to the present day. This video is going to focus on public health since 1900 in the modern era. Just a reminder, the key themes on people's health are impact of living conditions, response to epidemics and improving public health. And the key factors for you to be aware of are beliefs, attitudes and values, local and national government, science and technology, urbanisation and wealth and poverty. So without further ado, let's find out more. So in this video, we're going to talk about the economic, political, social and cultural change in the 20th century and how that might impact on people's health. We're going to look at living conditions and lifestyles, looking at four key areas of housing, food, air quality and inactivity. There's a couple of epidemics for you to know about, responses to Spanish influenza, Spanish flu, and also the AIDS epidemic in the 1980s and 1990s. We're then going to find out about growing involvement in public health from the government, including pollution controls, anti-smoking initiatives, and the promotion of healthy lifestyles, and including finding out about the significance of the National Health Service. Okay, in terms of how you're going to be assessed on people's health, you've got your three gateway questions, one word, short phrase, answer. There's always multiple answers for those questions as well. Question 2 is a write clear and organised summary that analyses. You need to link your answer to one or more second order concepts and make sure you include 2 paragraphs. Question 3 is a why or what was the impact question, focused on cause and consequence. Again, you need 2 detailed paragraphs for that question. And then question 4 or 5 is how far do you agree question. So you need your 4 key arguments with a degree of balance and then your clinching argument in your conclusion. So we're just going to look at the key characteristics and features of Britain since 1900 in each of the different areas, thinking about change between 1900 and the year 2000, and then what would have been the impact on people's health. So in terms of government and welfare, from the 1880s, most working men over 21 could vote. Between 1906 and 1911, the Liberal Party passed the Liberal Welfare Reforms, which included free school meals and old age pensions, and that was the start of the welfare state, where the government uses taxes to support and improve people's lives. In 1928, every adult in Britain could vote and the NHS was created in 1948. But by the year 2000, many thought that the cost of the welfare state was too high and governments have tried to restrict that in recent years. So in terms of the impact on people's health, it's great the government takes responsibility for people's health through the welfare state. Sometimes we talk about it being from cradle to grave. The Liberal welfare reforms tackle poverty through free school meals and pensions, and the NHS has improved the quality of healthcare for all. Science and technology has seen huge changes, and that's a key factor to be aware of. An Act of Parliament around about the year 1900 allowed the first cars on British roads. Cinemas began to open to show films which could be used to spread ideas about health. Radio signals began to be used, and there were improvements in travel and communication. The 1960s saw the arrival of the contraceptive pill. The developments in science have led to antibiotics to tackle infections. Cars and planes allow travel around the world. Computers can build and share knowledge at huge speed. It's worth noting that in 2020, scientists used cutting-edge technology to create a COVID vaccine. So all this means that it's easier to share information. Science has led to improvements in treating illnesses, and scientists are able to create vaccines quickly and efficiently to tackle a range of diseases. In terms of beliefs and values, at the start of the 20th century, most British people were Christians, with 55% of children going to Sunday school. However, some have challenged religious views. The British Humanist Society was founded in 1896. The horrors of World War I challenged some people's religious beliefs. During the 20th century, in 1948, the United Nations published its Declaration of Human Rights, and that means governments have a duty to improve people's lives. In the 2021 census, less than 50% of people describe themselves as Christian. Most people in Britain would turn to science, not prayer, in tackling illness. So a decline in religion meant people looked to science to treat illnesses, and the idea of human rights means that people have freedoms that are protected. In terms of wealth and work, most people in Britain worked with their hands in the year 1900 and have physical jobs, which meant that they tended to stay more active, and that could be positive for their health. Women generally stayed at home to look after the house and children, and young women often worked as domestic servants. Lots of changes on that in the 20th century. So since the first steps towards a welfare state in 1906, the government have raised taxes to pay for pensions and other benefits. That's led to more equality. The British economy has changed after 1950. There's less manual labour. Changes in technology and competition from other countries led to fewer jobs in places like shipyards, mines and factories, and new jobs in the service industry. So people tend to have more what we call sedentary jobs, where they are sitting down, and that's not always as good for people's health. There is now a better and fairer distribution of wealth. There's new types of jobs in the service industry instead of manual jobs. In terms of population, the population of Britain was 37 million in 1900. Farming was an important way of life. As more machinery was used, such as tractors, fewer people were needed to do labour on farms, and many families moved from villages to cities to find work. By the end of the 20th century, the population was 58 million. Cities now have a far wider mix of ethnic groups. The growth in Britain's population led to a growth in jobs and wealth, and also put extra demands on the welfare state. People have tended to move, therefore, from the countryside to the cities in the 20th century even more. Britain has become more crowded, which creates extra pressure on the welfare state, which is increasingly expensive. In terms of leisure and lifestyle, in 1900, the average worker did 54 hours per week, but still had Saturday afternoon and Sunday free. Leisure hours could be spent playing sport or being in the pub. General way of life involved a lot of exercise, with most tasks done at home through muscle power, and people walked a lot more. By the end of the 20th century, the average working week was 39 hours with more holidays. Huge growth in the leisure industry. People enjoy travel, music, films and sport, but some people lead more sedentary lifestyles, so they are less active. People are working fewer hours. There's huge growth in the leisure industry and entertainment, more things to do and to relax, but people get less exercise nowadays than they would have done at the start of the 20th century. And one of the health problems we're going to look at is the problem of inactivity. So in the year 1900, there were the social reformers that you need to know about. So there's John Galt, who was a Christian missionary and amateur photographer, and he showed images of sort of working class lives and what he called magic lantern shows to middle class audiences to raise awareness of poverty. He wanted to prove that the improvements at the end of the 19th century had not reached everyone, and he said that problems of dirt and disease were as bad as ever for some. Seaborn Rowntree studied the lives of poor people in York and published his 1901 book, Poverty, a study of town life. His background as a scientist was used to collect a range of data. He showed that poverty was caused in the main by large families or the loss of the wage earner. And Charles Booth was a wealthy London merchant. He collected data between 1889 and 1903, and he published his book, Life and Labour of People in London, showing that 35% of the population were living in desperate poverty. So the poverty reformers, combined with concerns about people not being passed as being fit to fight for Britain during the Boer War at the end of the 19th century, meant that there was real problems, and people were aware of there being real problems in terms of poverty in the start of the 20th century. So the four key areas of living conditions since 1900, we've seen there that housing, governments took more responsibility for housing with stronger regulations and Housing Act to improve standards. So homes fit for heroes, high-rise flats and the right to buy council houses. In terms of food, science allowed food to be transported from further afield. Refrigeration, freezers and tin cans improved things. The rise of the supermarket and convenience foods, rationing in World War II, but there's still been some fears about foods such as BSE and salmonella. There's a problem of inactivity in sedentary lifestyles, and it's estimated by 2013 44% of men and 33% of women were classed as overweight. And in terms of air, coal led to pollution, smoke and fog combined to create smogs. The 1952 smog in London killed 12,000 people, and the Clean Air Act of 1956 was brought in to respond to that. And vehicle exhaust fumes such as petrol and diesel engines still can create problems. Now, we found out in the work on industrial Britain that there were slum clearances at the end of the 19th century, but there's still quite a lot of problems in housing. So in terms of housing, one of the first huge changes in housing was that housing regulations improved in the early 20th century. Back-to-back houses were banned in 1909. The Housing Act was passed in 1919, promising homes fit for heroes for the returning soldiers from the First World War. And the local authority building programme set standards for space, water supply and drainage for all new houses. That was the start of the idea of a council house. And the Housing Act of 1930 led to further slum clearances. After World War II, there was the idea of streets in the air. World War II led to the destruction of 475,000 homes. Low-rise blocks of flats due to gas and electricity meant that coal didn't have to be stored or moved. So we can have flats now because we've got gas and electricity, and we don't have the problem of transporting coal high up into buildings. In 1960s, we have high-rise flats. 4,500 tower blocks were built by 1980. The development of the lift, combined with incentives to build 6-storey towers, led to a big increase in those. After 1979, when Thatcher became Prime Minister, there was a decline in council housing. 42% of the population lived in council housing compared to 1% in 1900. The Housing Act of 1980 gave tenants the right to buy their council houses. That led to a rise in renting from private landlords and a decrease in council housing stocks. Now, some private landlords have not met the government standard for healthy homes set out in 2000, and there's still problems today in terms of housing of mold, damp, cold, poor lighting and other health and safety issues. So just some images here of housing in the 1920s. So people able to use things like electric cookers in homes. There's an advert there for a modern kitchen in 1922. You can see here some of the impact of housing after World War II locally in York. You can see some of the damage that was done. So 475,000 homes were destroyed in World War II. There's a picture there of Hanover Street in York, which was hit by an air raid in April 1942, and St Martin's Church on Coney Street after the York air raids of 1942, and housing in Water End, York, also hit by air raids. So there's a huge increase in high-rise flats being built after the Second World War. The first high-rise was the Lawn in Harlow, which you can see pictured there, which was built in 1951. And then we've also seen about the idea of council houses being able to be bought by tenants from 1980s Housing Act. So we're just going to look at the idea of inactivity now. So there were concerns even way back in the 1920s that people were not exercising enough. During World War II, people were more active, so the government weren't as concerned because of rationing. People were eating better. Petrol rations meant that people were walking more. Exercise dropped as more people used trains and trams in the early 20th century. However, new technology with the TV means more sitting on the sofa. People don't even have to move to change the channel with the remote control. People tend to watch sport on TV rather than do it themselves. And power tools and appliances or robots in factories mean less manual labour. People have got more income to spend on unhealthy food or sweet foods, non-essential foods. A 2013 research showed poorer parts of society were the least active. Nearly 3/4 of people with no qualifications do little to no exercise. So you can see there a big problem of inactivity. So a big change since 1914 when 40% of men were too weak to fight, whereas in 2006 a third of teens were seen as being too obese to join up for the army. 44% of men and 33% of women were classed as overweight in 2013. And the Industrial Revolution has made labour-saving devices more widely available. So people have become much more consumers of things in the 20th century. So that's all about inactivity. Okay, in terms of food supply and quality, I'm going to look at this in a bit more detail. But in terms of World War II, imports fell during World War II, so food was rationed. People were encouraged to grow their own food and keep animals to dig for victory. Rationing actually improved diets and people's health. After 1950, people became richer and could afford new technology. The impact of immigration meant that Indian and Chinese food, as well as other types of food, Italian food as well, became more popular. In terms of technology, refrigeration and canning improved supply and made food cheaper. Home refrigerators have allowed people to keep foods longer, and microwave ovens have led to convenience foods such as microwave meals becoming popular. There's been fears over food. The disease BSE, mad cow disease, affected cattle and spread into the human food chain in the 1990s. That created fear about modern farming methods, and fears about artificial ingredients led to a demand for fresh local produce and organic food as well. So you can see there that the supermarket has had a huge increase in the way that we shop for food. Food tends to be less fresh, and there's more artificial chemicals used on food to keep it preserved and to make it look nice. Food miles has become an issue. There's more what we call processed food now with a high sugar and high salt content, which isn't good for people's health. So at the start of the 20th century, new grocery stores such as Lipton's and new ways of preserving food in cans changed diets at the start of the 20th century. The first can of beans was in 1905. Baked beans were a huge hit in the UK, and salesmen would travel door to door with flasks of heated beans so people could try them. The first factory opened in Peckham in South London in 1905. You can see there about rationing during World War II. People were encouraged to eat things like carrots and potatoes, for example, and to grow your own vegetables. And people had to queue for their food shop. So that actually had a positive impact in terms of people's diets and eating healthier food. And then here's some of the fears about food. In 1986, a new disease called BSE affected the brains of cows, led to a deadly and incurable brain disease in humans called CJD. Now, rickets is a disease caused by the body not getting enough vitamin D. Many people in poverty in 1900 got rickets due to poor diets, as you can see that child there with rickets in the early 1900s. From 1942, scientists recommended added vitamins to bread to tackle this. The body also needs sunlight to build up vitamin D. Now, in 2014, doctors reported an alarming increase in rickets. Poor diets and people not going outside enough and sedentary lifestyles have caused the increase. Okay, now another lifestyle issue since 1900 has been pollution. So in the first part of the 20th century, smog, smoke and fog in the big industrial cities from factories caused conditions such as pneumonia. The Great Smog of December 1952 led to the death of 12,000 people in London, and you can see an image of that there. And then car ownership has increased massively in the late 20th century. Diesel and petrol fumes can create health problems, including breathing issues, making things like asthma worse, and that's led to the creation of congestion zones and clean air zones. Yes, we just looked at some progress and regression in terms of the government tackling pollution. So improved oil, gas and electric heating systems mean we rely less on coal today, which is a really polluting source of fuel. The Clean Air Act is a really significant event. So that was passed in 1956. And it meant that factories and homes had to burn smokeless fuel. These clean air zones grew over time, and by 1980s, smog was no longer a problem. Law has forced scientists to make lead-free fuels from the 1990s, so now all petrol is unleaded. From 2001, the government encouraged diesel cars because they thought they were better in terms of pollution because they use less fuel, but it actually turns out they release more carcinogens into the environment and is really bad for people's breathing. So that has created other health problems. The government announced in 2017 that it planned to ban all new petrol and diesel cars from 2040 onwards and really promote the use of electric cars. In terms of regression, 1926 laws allowed the police to prosecute factory owners that created excess pollution were rarely enforced. Smog could cause serious breathing difficulties and even death. So in 1952, in that serious smog in London, around 12,000 Londoners died. Car ownership has increased in Britain by 25% between 1980 and 1990. Diesel probably causes more harm than we thought. And exhaust fumes are causing smog again. Athletes training for the London Marathon were warned not to go outside in certain weeks due to pollution levels. Okay, so in terms of response to epidemics in the 20th century, you've got two different epidemics to focus on. The first one is Spanish flu, which took place from 1918 to 1919. It killed 50 million people worldwide, more than World War I, and in Britain, it killed 228,000 people. But this time, the government brought in lots of measures to tackle the epidemic, such as isolation and the wearing of face masks. People had more understanding of how the disease was spread. So the actual response to Spanish flu was far superior than to the other epidemics. Now, the AIDS epidemic, which lasted from the sort of late 1970s to around about 1996, AIDS is not a disease, but a way of describing a condition where the immune system can no longer fight infection. In 1984, scientists named the virus that causes AIDS HIV, which stands for Human Immunodeficiency Virus. Doctors discovered it was passed on through sharing blood or bodily fluids, such as through blood transfusion, sexual contact, or sharing needles. Now, AIDS has had a stigma, and perceptions of the disease have changed through time. So in terms of the Spanish flu, devastating to health, the symptoms were horrible. Cold flu-like symptoms, high temperature, aches, pains, coughing and sneezing. The symptoms could develop into pneumonia with the skin going blue, bleeding from the nose, ears or stomach. The flu originated from a bird flu, which also affected humans. But the reactions to Spanish flu had mainly positive effects in terms of face masks preventing contamination, newspaper films and posters giving advice on how to treat contamination. In terms of the response to HIV and AIDS in Britain, there are 5 distinct phases of reaction to AIDS in the UK, and we're going to look at that in just a bit more detail in just a moment. So from the 1970s to 1983, there was raised awareness of the disease, but a negative reaction. People were stigmatized for having the disease, and people were often badly treated if they had the disease. There's lots of prejudice towards gay people as a result of the AIDS epidemic. 1984 to 85, there was a growing alarm and fear of AIDS and that it could spread easily through the slightest contact with the victim. From 1986 to 1987, there was better understanding of AIDS. Diana, Princess of Wales, shook hands with and hugged AIDS victims, showing the disease was not spread by touch. Publicity campaigns also helped educate the public. From 1988 to 1995, there was understanding and acceptance of HIV/AIDS. TV, such as EastEnders, the BBC soap, and media embraced the need to publicise the disease and have a supportive attitude. There was support for charities and research, including a Freddie Mercury tribute concert. And then from 1996 onwards, there's been a worrying decline in awareness of HIV/AIDS, and that's partly to do with the invention of discovery of retroviral drugs that can be used to manage and treat the condition. So educational campaigns about HIV and AIDS have stopped, and HIV and sexually transmitted infection cases are again on the rise. So let's have a look at these in a bit more detail. So phase one is growing awareness. In the early stage of the disease, there was lots of fear and scare stories. Terence Higgins was one of the first people to die of AIDS in Britain, and his family set up the Terence Higgins Trust to raise funds for research and to increase awareness about the disease. Now, as there was more awareness of AIDS, there was more fear and alarm over the disease, which led to misunderstanding of what caused the disease and also prejudice and discrimination, particularly towards the gay community. Now, the growing understanding, Princess Diana's actions here were really important. You can see a picture here of Princess Diana visiting the London Middlesex Hospital to open the UK's first unit for treating people with HIV infection, and her decision to shake hands with a patient with HIV without wearing gloves challenged the misunderstood belief that disease could be transmitted via touch. The government also ran a Don't Die of Ignorance campaign, which was narrated by the actor John Hurt. And you can just see a still of that poster about AIDS, Don't Die of Ignorance. Growing acceptance in phase 4 between 1988 and 1995. Still no known cures during that time. Queen singer Freddie Mercury died from AIDS in November 1991. There was a huge concert in 1992 at Wembley, which raised over 20 million for AIDS charities. And in terms of the BBC television soap EastEnders, portrayed a character called Mark Fowler, who's pictured there, who was diagnosed with HIV in 1991. That helped raise awareness and challenge people's prejudices and misunderstandings about the disease. Then finally, in phase 5, growing complacency. In 1996, new drugs called antiretrovirals were developed, which slowed the onset of AIDS in people infected by HIV. It's not a cure for the disease, but allows people infected with HIV to live a normal life expectancy by taking these drugs each day. The drugs have become simpler through time. So in the 1990s, people were taking up to 20 pills a day at different intervals. Now, as little as one pill per day can deliver those multiple drugs at the same time. This has led to less awareness about HIV and AIDS, and subsequently the number of people infected has increased. Okay, in terms of public health in the 20th century, in 1906 the Liberal government won the general election, prompted by poverty reports and the fact that for the Boer War, 40 to 60% of recruits were not found to be healthy enough to sign up to fight. The Liberal government set about the start of the welfare state. And a key politician behind this was the Chancellor David Lloyd George, who had become Prime Minister from 1916 to 1922. The welfare state was the key part of 20th century public health, providing people with support and help from cradle to the grave. So these are some of the changes in the so-called liberal welfare reforms that were brought in. Now, before the Liberals came to power, the Midwives Act had been passed in 1902, and that regulated midwives who were nurses who specialised in the birth and care of babies by requiring them to have a certificate. The long-term impact of this was that the Central Midwives Board was set up by the Act, lasted until 1951. Free School Meals Act of 1906 provided a hot meal for some poor children. It was the responsibility of local councils to choose whether to fund them or not. But the principle of giving poorer children a free meal was made compulsory in 1914, and the school milk scheme began in 1934. Medical inspections were brought in schools in 1907 as part of the liberal welfare reforms. That had an immediate impact. It examined all children, but it didn't treat the problems it found. Longer term impact, school clinics were set up in 1912 to treat children. Medical inspections continued, and by the 1930s, most local councils had provisions to treat minor illnesses. Old age pensions were brought in 1908. It saved many of the aged poor from the workhouse, which were places where the poor went if they were homeless and penniless, and the principle of providing help for the elderly still exists today. So a really important event, the Old Age Pensions Act. National Insurance Act provided protection against unemployment and sickness, providing money for people to live on, and the principle of helping working people that have lost their jobs or they can't work through sickness, for example, that still exists today. So they're the main liberal welfare reforms. After World War I, the Housing Act of 1919 promised 50,000 homes fit for heroes, but economic problems meant that only about half were built, just less than half. But a series of housing acts over time led to slum clearances, council housing, and government recognition that housing was a social responsibility. The Local Government Act of 1925 ended the workhouse system and local councils took responsibility for running local hospitals. Old workhouses became new hospitals and they were eventually taken over by the NHS in 1948. Immunisations were brought in 1940, so there was a mass immunisation programme against diseases like diphtheria, for example, in 1940, and tuberculosis, or TB, in 1948. Long-term impact, vaccinations became routine under the National Health Service. Okay, so the National Health Service was brought in 1948, and this had a huge and significant impact on public health. In the short term, it provided free medical care for all UK citizens, and this was absolutely groundbreaking because before the NHS was brought in, many people, if they couldn't afford it, simply had no access whatsoever to healthcare. It led to a huge increase in people accessing the NHS for dentistry and eye tests. Doctors were allowed to keep private patients, so they supported the changes and joined the NHS, and it was a huge turning point in healthcare, delivering on the 1942 Beveridge Report, which had promised to tackle the 5 giant evils in society, including disease. In terms of the long-term impact, it meant that healthcare was no longer a luxury that only a few could afford. But the NHS is becoming increasingly expensive, so prescription charges were introduced in 1952 and extra charges have also been introduced for eye tests and dentistry. The NHS is still highly respected in the 21st century and the principle of free healthcare at the point of service still remains, showing how significant the NHS has been both in the short term and the long term. Now, the Clean Air Act of 1956 was brought in to control air pollution and create clean air zones, partly in response to the London smog of December 1952, and that was the first of a series of laws to protect the environment. Health and Safety at Work Act of 1974 put regulations in place to ensure the health and safety of workers, and that's created a long-term impact of making sure the government is responsible for people's safety at work. Okay, so the government's also brought in laws to tackle smoking. In 1962, the link between smoking and cancer was accepted, so the government began to introduce measures to encourage people to stop smoking. Between 1964 and 2016, the government took steps to tackle smoking, that included banning cigarette advertising, promoting nicotine replacement products, and banning smoking in public places, and finally making cigarette packaging blank. The government has also begun to tackle the problem of obesity, which is a major cause of heart disease. Campaigns to eat less and move more are helping to combat this. The government has also been criticised, though, for being too slow to act, particularly against smoking because of a loss of tax revenue from selling cigarettes and the loss of donations from tobacco companies. And sometimes people criticise the government for getting too involved in people's health, being too interfering or so-called nanny state. Some people think that people should be free to buy what they want, even if it harms them. So a really important event which brought about the government laws against smoking was that in 1962, the Royal College of Physicians in London published Smoking and Health, a document that proved that smoking tobacco caused lung diseases such as cancer. This was a turning point in governments taking action to address smoking. So it led to all of those following changes: cigarette advertising banned on TV in 1964, government health warnings printed on cigarette packets in 1971, cinema advertising of cigarettes banned in 1986, in 1998, the government agreeing to fund free nicotine replacement therapies for anyone wanting to quit smoking. Now, a huge event was that in 2007, smoking was banned in all public places after a 2005 medical report showed that passive smoking probably kills more than 11,000 people each year. And from 2016, all cigarette packages had to be blank with no attractive colours and health warnings on the packets. So why was action against smoking so slow? So we've kind of talked about this, but the government needed the money raised from tax paid on cigarettes sold. The tobacco companies are wealthy, have defended their industry against increased restrictions. Some people feared a ban on smoking in public places would lead to an increase in smoking in the home, affecting the health of children. Pubs and restaurants resisted the smoking ban as they feared it would affect their business. And smoking isn't illegal, and governments are often reluctant to restrict people's freedom to make choices. So the government now gets involved in public health in lots of different ways. Okay, so after the laissez-faire attitude of the 19th century, the government has now been accused of being too involved in people's health and creating a nanny state. So NHS website allows you to calculate your BMI to establish how healthy you are. They run vaccination programs. They run campaigns such as Change for Life campaign in the 2000s to encourage healthy lifestyles. They have health and safety at work. You have to be over 18 to buy alcohol. Scotland's introduced a minimum price to ensure it's not too cheap to buy alcohol. Research and reports on how to address drug usage. We talked about education in school about spread and prevention of sexually transmitted diseases, and lots of discussions have taken place about introducing a sugar tax. So we've seen the government's approach change hugely in the 20th century, and now it's accused of being almost too involved in people's health, the idea of a nanny state rather than a laissez-faire attitude. Okay, so that was a revision video on people's health, modern Britain, 1900 to the present day. Hope you enjoyed that and learned something from that. Thanks very much for listening. Bye-bye.